Hello everyone, today we are going to learn about a topic is renal vascular disorder. It means renal means kidney, vascular means blood vessels, and disorder means complication or any disease, right? In this video we are going to discuss about the kidneys, blood vessels disorder, right? Renal means kidney, vascular means blood vessels, or disorder means disease or any complication, right? In this video we are going to discuss about kidneys blood vascular disorder, right? Now in this video we are going to cover about some important topics, right? Some important topics like introduction part of your renal vascular diseases, pathology of kidney in hypertension and diabetes mellitus and pregnancy. Another is peritonitis. Next one is induced changes. Another is urinary tract infections. Next one is pyelonephritis. Another is tuberculous pyelonephritis, right? In this video we are going to cover each and every topic one by one, right? Now firstly we are going to discuss about the renal vascular disorder, or introduction part of your renal vascular disorder, right? Whenever your kidneys are mainly depend upon your blood pressure, right? Your kidney functions depend on your blood pressures. When sufficient amount of blood pressure get reached to your kidneys, hence it work of your kidneys working properly, right? And adequate amount of GFR, glomerular filtration rate is occurred in your kidneys, right? And overall function of your kidneys do, right? Whenever your blood vessels of your kidneys get injured or damaged, then it leads to a vascular diseases, right? Now we are going to discuss about renal vascular diseases. Renal vascular disease affect the blood flow into and out of the kidneys. It may cause kidney damage or kidney failure or a high blood pressure, right? There are some conditions can lead to a renal vascular diseases. First one is renal artery stenosis. It means when your kidneys arteries get narrowing or a blockage in your artery in your kidneys, then it is called a renal artery stenosis, right? Renal artery stenosis, smokers have a greater risk of getting a renal artery stenosis, right? For better understanding, I am going to share you a video of renal artery stenosis, right? Now this is the structure of this is a pair of structure of your kidney. Then it is a renal artery, right? This is the renal artery, and this is the aorta, abdominal branch of your aorta, right? Now we are going to discuss about, and we can understand easily difference between the stenosis and occlusion, right? Stenosis means the decrease in blood flow to the kidney, right? And occlusion means the complete blockage of blood flow to the kidney, right? Now you can understand easily difference between stenosis and occlusion, right? Now what is the etiology of renal artery stenosis is in occlusion thrombus. It means whenever your clot in your renal artery, then it's causing an occlusion in your kidney, right? Another is embolism, right? Embolism from your heart to your kidney, right? Another is stenosis. Stenosis means Occlusion can be, you can understand easily, occlusion can be caused by thrombus or a embolism, right? On the other hand, stenosis can be caused by a 90% caused by a atherosclerosis. It means a fatty substance get deposited in your artery walls, right? Then it is called a atherosclerosis. 90% cases caused by a atherosclerosis, right? This yellow substance is the fatty substances, right? Blockage of your renal artery. This condition is called atherosclerosis. It generally it can be affected in older adults, especially greater than 60 plus age. Another hand, 10% stenosis can be caused by a fibromuscular dysplasia. It means when you are twisting of your renal artery, this is called a fibromuscular dysplasia. Right? 10% people can be affected by a fibromuscular dysplasia. This is the structure of your kidney, right? This is the renal artery, right? Then the renal artery get twisted, that can lead to a fibromuscular dysplasia. This is the another complication of your renal artery stenosis, right? And fibromuscular dysplasia mainly caused in 20s age pupils, and it's greater risk, female having a greater risk than male, right? Now how we can diagnose your right? This is all about your renal artery stenosis. Another condition of your renovascular disease is renal artery thrombosis, right? Renal artery thrombosis, it means when your blood clot is present in your renal artery, that it can hamper the blood flow to the kidneys, right? It may block of blood flow, can cause a kidney failure, right? Another condition of your renovascular disease is renal vein thrombosis. This is also a clot in a vein to a kidney. This is called a renal vein thrombosis. Another condition of your renovascular disease is the bulging. It means aneurysm. Aneurysm means bulging. Bulging can be seen easily by a weak area in the wall of the arteries to the kidney. Most are small and don't cause symptoms, right? Renal artery aneurysm are rare, are more often found during the test of other conditions, right? This is the renal artery aneurysm. It means bulging or a swelling. It can be caused by a weakened area of your artery, right? Now there are some etiology conditions caused by your renovascular diseases. First is most common is atherosclerosis. Another is injury. Whenever your kidneys blood vessels get injured, can lead to a renovascular diseases. Another is inflammatory conditions or other underlying causes leads to a renovascular diseases. Another is surgery. It's may be caused to a renal vascular disease, tumor. Another is pregnancy is also another cause causing a renal vascular disease. Another is birth defect, right? It's called a congenital diseases of your renovascular diseases, right? These are some common causes leads to a renal vascular disease, right? Now we can going to discuss about a treatment of renal vascular diseases. Firstly, we are going to discuss about the treatment about the renal artery stenosis, right? In renal artery stenosis treatment, like thrombolytic, it means clot busting medicines may be infused into the renal artery for breaking the clot in which are present in your renal artery, right? For several days to break up the clot, right? Another is surgery to remove the clot or a bypass surgery that the artery may be done in some situations, right? Surgery is another method to treat the renal artery stenosis, right? Next disease is renal artery aneurysm. Renal artery aneurysm treated by a treatment may be depend on the symptoms and the size and the location of the aneurysm. Generally surgery may be used for aneurysm, right? Another disease is arthroembolic renal diseases can be treated by medicines that leads to a lower blood cholesterol, low blood pressure, and treat other related complications such as diabetes, right? Next method is surgical method that may also be used for the treatment of arthroembolic renal diseases patients, right? Another disease is renal vein thrombosis. It can also be treated with anticoagulants that break your clot, that breaking out of your clot that are present in your kidneys, which means keeping the blood from the clotting, which may be given intravenously for several days, then given by mouth for a few weeks or more, right? Some anticoagulants may be used, right? Now we are going to discuss about pathology of kidney in hypertension condition, pregnancy, and diabetes mellitus patients, right? In this video we are going to discuss about pathology. It means diseases of kidneys during a hypertension or in pregnancy or in diabetes, right? First is hypertensive nephropathy. It means hypertension can lead to a kidney damage. Now blood pressure is the force. We are going to understand firstly what is blood pressure. Blood pressure is the force of blood pushing against the blood vessels that as the heart pumps out the blood, right? Increase the amount of force that blood places on blood vessels and it's moved through the body, right? You can understand easily with this diagram. This is the normal blood pressure, and when you increase the blood flow, and you can understand easily your blood pressure is slightly high, right? Then it is normal, right? This is the then is narrow. It means when your blood vessels get narrowed, it can also lead to a high blood pressure, right? This is the normal blood vessels, right? Normal blood vessels. Whenever your blood flow is normal and blood vessels diameter is also normal, that can lead to a normal blood pressure, right? And whenever your blood flow increase and renal your blood vessels having a same diameter, then it can lead to a high blood pressure, right? Whenever your blood vessels get narrowed and blood pressure is normal, then it can also lead to a high blood pressure, right? You can understand easily what is blood pressure, right? Now what is the stages of your hypertension, right? Systolic pressure, it represents the pressure of the heartbeat and pushes the blood through the blood vessels, right? And on the other hand, diastolic pressure, and it represents the pressure as the blood vessels relax between the heartbeat, right? Your blood pressures making up by two pressures, by systolic and diastolic, right? Top and bottom. Normal is 120, less than 120 by less than 80 mmHg, right? This is the stages of your hypertension. Hypertensive emergency is a hypertensive crisis. It means greater 180 mmHg blood pressure of your systolic blood pressure and greater than 120 mmHg diastolic pressure. It means a hypertensive emergency, right? Now hypertension can lead to a renal diseases, right? It means renal failure. So it is called a renal vascular hypertension. Hypertension is the major complication that leads to a kidney failure, right? High blood pressure is a leading cause of the kidney disease or kidney failure or an end stage renal disease. Hypertension can cause damage to the blood vessels and filters in the kidney, making the removal of blood from the body difficult, right? Hypertension damage your blood vessels, right? Blood vessels of your kidneys. Now this is the etiology caused by atherosclerosis. 70 to 75% hypertension of renovascular hypertension caused by atherosclerosis. It means fatty deposition of your artery walls, right? Another is fibromuscular dysplasia, the 10% to 25% cases. It means twisting of your artery walls, artery, right? It is called a fibromuscular dysplasia. It is 10 to 25% people can be suffered, right? Another is aortic renal dissection. Next is thrombotic cholesterol emboli. Another is CVD, cardiovascular diseases. Another is post-transplantation stenosis, means narrowing and blockage of your artery walls. Another is post-radiation, is the most common conditions that can lead to a renovascular hypertension, right? You can see narrowing in the artery that deliver the blood, right? It is called renal artery stenosis. Narrowing in one or both the renal arteries is the most common caused by the atherosclerosis or hardening of the arteries. This is the same process that leads to make a heart attack and a stroke. Another is fibromuscular dysplasia. It means the twisting of your arteries. Another is dehydration, is the another cause of your renal hypertension. It means releasing hormones that stimulate the body to retain sodium and water. Then it can lead to high blood flow and blood vessels fill with additional fluid and apply a high blood pressure on your artery walls, right? Now we are going to discuss about the pathophysiology of renovascular hypertension, right? Whenever you decrease your renal perfusion pressure, then RAS system get activated, right? RAS system whenever your blood pressure get decreased, renin is an enzyme that is secreted from your juxtaglomerular apparatus. Then it activates the angiotensinogen, which is present in your lungs. Then it's converted into the angiotensin 1, and angiotensin 1 is further converted into angiotensin 2, right? Angiotensin 2 causing a vasoconstriction, which causes the hypertension and enhance adrenal gland and release the aldosterone hormone that can lead to a sodium and fluid retention in your blood vessels in your body, right? And when blood volume is increased, then blood pressure get also increased, right? That can lead to a hypertension. Contralateral kidneys, if unilateral RAS, renal artery stenosis, respond with diuresis. It means sodium output in your kidney and H2O excretion. It means water excretion, which may return plasma volume to normal, right? With sustained hypertension, means retain in your body hypertension for several days, plasma renin activity decreases, right? Bilateral renal artery stenosis or a solitary kidney renal artery stenosis leads to a rapid volume expansion and ultimate decline in renin secretion, right? It can lead to a normal condition, right? Now you can see what the symptoms you can see patients in renal hypertension, right? Like headache, edema, appetite loss, nausea, vomiting, drowsiness, trouble in concentrating, sleep problems, increase or decrease urination, generalized itching and numbness, dry skin, headache, weight loss, darkened skin, muscles cramp, shortness of breath and chest pain. These are the some common symptoms you can see easily in a renal hypertensive patients, right? Now, how we can prevent renal kidney diseases, right? First, to prevent kidney damage from high blood pressure, right? We can control our blood pressure and make sure you get your blood pressure checked on a regular basis, right? Eat a proper diet, exercise. Another is take medicines from your doctor's prescription, healthy eating, physical activity, maintaining body weight, quitting smoking, and managing your stress level in your body, right? These are some prevention method from your kidney diseases. Now, how we can treat your kidney disease patients? For patients who have a high blood pressure and kidney diseases, the most important treatment is to control your blood pressure through a lifestyle changes, right? ACE inhibitor, these are some medicines you can take in a hypertensive hypertensive patients: linsopril, captopril, benzapril, and namapril. And angiotensin second receptor blockers, that is valstrain, lorastrain, candistrain, amlistrain. These drugs can lead to a low blood pressure and protect the kidney from further damage, right? But treatment need to be individualized, right? Renal vascularization versus medical therapy for atherosclerosis, it means fatty deposition in your arteries walls, right? Each and every patient treated individualized in a kidney patients, right? Now we are going to discuss about diabetic nephropathy. It means diabetic kidney diseases. It means whenever your kidney get damaged by diabetes, that can also lead to end-stage renal failure. These patients can be treated by blood filtering or dialysis. In this condition, filter nephrons, it means filtering unit of your kidney, get damaged by the diabetes, right? Diabetes is a complex group of disease with a variety of causes. High blood glucose. Diabetes is a disorder of metabolism. Diabetes can be divided into two types: type 1 diabetes, another is type 2 diabetes. Like type 1 diabetes is lifelong diseases that occurs when the pancreas does not produce enough insulin to proper control blood sugar level, right? Whenever your blood sugar level rise in your body, your blood sugar get damaged, your blood vessels also, that weaken your blood vessels, right? And damage your kidneys blood vessels, that can lead to a kidney failure, right? Another is type 2 diabetes. This is also called a non-insulin dependent diabetes. Is a disorder that is characterized by high blood glucose in the context of insulin resistance. Whenever your body cells get insulin resistance and relative insulin deficiency in your body, right? Diabetes leads to kidney diseases in several ways. At the onset of diabetes, blood flow into the kidney increases, which may strain the glomeruli and lessen their ability to filter blood. High blood glucose level leads to a buildup of extra material in the glomeruli, which increase the force of blood moving through the kidneys and create stress in the glomeruli. That easily understand whenever your blood glucose level is high, then blood is entered in your kidney, that damage your blood vessels or a glomeruli or a nephron in your kidney, that is the filtering unit of your kidney, and damage your kidney, right? This stress level to gradual and progressive scarring of the glomeruli, that can also damage your kidney, right? Another factor is hereditary, diet, lifestyle, and other medical conditions that can lead to a kidney diseases, right? Now, there are some common symptoms of diabetic kidney diseases, like swelling of the hand, feet, and face. Another is trouble in sleeping and concentrating, poor appetite, nausea, weakness, itching, drowsiness, abnormalities in the heart regular rhythm, and muscle twitching, right? These are some common symptoms in diabetic kidney disease patients. Now, how we are get treated diabetic kidney patients, right? As a physical examination, you can see, examine easily skin color, tape on specific areas of body patients, checking the swelling of the feet, ankles or lower legs, right? Another thing is we are going to check by urine test, dipstick test for albumin and urine albumin to creatinine ratio. These are the some tests to diagnose your diabetic kidney patients, right? Now, how we can prevent the diabetic kidney disease patients? By taking medicines to control the high blood pressure, managing your blood glucose level, eating, diet and nutrition. There is another method to prevent your diabetic kidney diseases, and losing your weight and physical exercise. These are some prevention methods to diabetic kidney diseases. Now, how we can manage the blood glucose? Testing the blood glucose throughout the day, diet and a physical activity plan. Another is insulin, taking insulin throughout the day based on the food and liquid intake and physical activity. There are some ways to manage your blood glucose level, right? Eating, diet and nutrition. This is the most important thing to manage your blood glucose level in your body, right? Right, following the healthy and eating plan and help your blood glucose pressure and blood glucose level, right? Blood pressure and blood sugar. A healthcare provider may recommend the dietary approaches to stop hypertension and eating plan, right? It low fat and cholesterol. And another is fat free and low fat milk and dairy product, fish, poultry and nuts. Suggest less meat and fewer sweets, added sugars and sugar containing beverages, right? You can take in less amount, right? And you can take rich amount of nutrients, protein and fibers in your diet, right? These are the some things you can add or cut down in your diet plan and prevent your kidney diseases from diabetes or blood pressure, right? Now, how is kidney failure due to diabetes kidney disease treated, right? A healthcare provider may treat kidney failure due to diabetic kidney diseases with dialysis. This is the last option, and or a kidney transplant is the last and ultimate option for kidney disease patients, right? In some cases, people with diabetic kidney disease receive kidney and pancreas transplant also. Now, we are going to discuss about pathology of kidney in pregnancy. Chronic renal disease in pregnancy. Renal disease in pregnancy is an important medical disorder resulting in worsening of renal function and increased fetal morbidity or mortality. The incidence of chronic renal disease in pregnancy is rare, but by chance your kidney get damaged during your pregnancy, that increase the risk of fetal morbidity and mortality, right? Mild compromised renal function, right? Serum creatinine level whenever is greater than 125 μ/μol per liter is generally not associated with any adverse maternal and fetal outcome, right? Less than effect of pregnancy on long-term renal function and development of end-stage renal failure. It means greater than 500 micromole per liter, or the need of dialysis is very low, 5%, right? This is the moderate or severely compromised renal function. Whenever you're greater than 125 micromole per liter of your creatinine level is generally associated with adverse pregnancy outcome, and 50% of renal function deteriorate. Pregnancy outcome is adversely affected by the rising level of proteinuria. Whenever your protein in your urine present, hypertension and serum creatinine. What effect of renal disease on pregnancy? Like abortion, preterm labor, IUGR, it means intrauterine growth reduction, and IUFD, it means intrauterine fetal diseases, are the known fetal risk when your kidney diseases during your pregnancy. However, with improved pregnancy surveillance and neonatal care, outcome has improved. It depends on the severity of renal diseases. When the renal function is mildly compromised, when serum creatinine level less than 125 millimicromole per liter, the risk of end-stage failure is low, less than 5%. Right? Renal disorder means urinary tract infection, chronic renal disease, acute renal failure, and pregnancy in renal transplant recipient. These are some common renal disorders you can see easily in renal patients, right? Urinary tract infection, it means UTI. It's most common in female, right? Asymptomatic bacteria, it means 75 to 90% due to Escherichia coli bacteria get affected the female urinary tract infection. It means colonization of the urinary tract result from ascending infection from the perineum, and it is related to sexual intercourse, right? Antibiotics such as ampicillin, amoxicillin is given for the treatment, right? These are some antibiotics can be used during the UTI infection. Another is acute cystitis. Cystitis means inflammation in your gallbladder. In most cases, the causes of cystitis is a urinary tract infection, right? Clinical features in urinary tract infection is urinary frequency, dysuria, hematuria, and suprapubic pain. Now, what is acute renal failure? Rare complication in pregnancy in which sudden decrease in renal function with oliguria over a period of hours or a days, right? Clinical features is anuria. It means lack of production of urine, and oliguria, creatinine rise, and decreased GFR. Now, what is the causes of acute renal failure? Infection, right? Infection is the most common causes of acute renal failure. It includes the septic abortion, purinal sepsis, rarely acute pyelonephritis. Advice should be given for increased fluid intake, emptying the bladder following sexual intercourse. Antibiotics is given for the treatment, right? Acute pyelonephritis is a sudden or a severe kidney infection. It causes the kidney to swell and may permanently damage them. Pyelonephritis can be a life-threatening condition, right? Pyelonephritis is an inflammation of the kidney, typically due to the bacterial infection. It is the ascending urinary tract infection that has reached the pelvis if the kidneys, right? Now, what is induced changes in renal? Induced changes, it generally means drug induced can cause acute renal failure, intrarenal obstruction, interstitial nephritis, nephrotic syndrome, and acid base and fluid electrolyte disorder can be caused by a drugs. If you have taken any drugs that can be harmful to your kidney, that damage to your kidneys, blood vessels, and leads to a nephrotoxicity, right? There are some certain patients and non-specific clinical situations, drugs shown to cause a nephrotoxicity and exerts the toxic effect by one or more common pathogenic mechanism, right? There are some nephrotoxic drugs that can lead to a kidney failure. Clinical features you can see: fever, like abdominal pain, vomiting, proteinuria, hematuria. These are some common signs and symptoms you can see easily in a kidney failure patients, right? Now, how we can manage? IV means intravenous antibiotic penicillin you can give in a patient, and cephalosporin are the first line of choice of drug, right, for treating the UTI or infection in your kidneys.